In this video, I will share some insights into chronic pain and to educate you guys on this as well, this topic of pain treatment. As someone who has had chronic pain, that is pain that has lasted over 3 months in my lower back, I've had my own ups and downs in my personal pain journey. Even as an occupational therapist and with my background in pain education, management, and treatment, going through it myself really has taught me a lot. And so here are some things that may help you so that you can live a happier and healthier and functional life with pain. If you are new to this channel, my name is Jeff, and I am a licensed occupational therapist practicing in America. A common misconception about occupational therapists is that they help people to find jobs, but instead, they help people to do the things that they want to do that are meaningful to them. My goal is to increase awareness about the profession of occupational therapy to help people live healthier and happier lives. If this resonates with you, consider subscribing to this channel and joining to be a member. Check out the video description for more free helpful resources such as my website and other ways that you can help support this channel. I'm the OT Dude, and let's get functional. The thing about pain is that we all experience it to some degree at one point or another, even if it's like a quick thing like you accidentally kick something. But chronic pain is definitely a more difficult issue to manage or to treat. Yes, there are some exceptions I understand, such as those with diabetes or rare conditions who may not feel pain or experience less of it. But pain should be seen as this thing that really helps to protect and just really help us. Without this alerting system, then we may not really know then, right? When we may have gotten injured, or we may continue to do things like lifting too heavy of an object repetitively and not know that it is harming us. And when I injured my back, I saw pain as this like enemy thing that gave me anxiety even. And in school, what I learned in practice, even among other healthcare professions, I think, intentional or not, they may instill a lot of fear related to this concept of pain. And things like, don't bend or don't lift or don't twist or don't lift anything or don't do any whatever. And this can be really restricting, right? And it may be teaching us to do things in a different way than we're really used to. And it may make us feel more anxious, for example, right? And while, yes, I think this is probably true in acute pain, we may have been too conservative, and it may not be the best long-term strategy as a learned habit as we may have thought, especially for chronic pain. And this fear can be equated to something like, the fear of falling. If you have had several falls, then you may not want to be as mobile again because you may fall again. But studies have shown that immobility, and that's related to pain too, because sometimes we don't want to move when we have pain. It can feed into a cycle and make us more weaker. And the same applies to pain. Pain may make it so that we may not move, but our bodies are very remarkable healers, and they heal quite well and quite fast, depending on many factors, of course. And I've taken this approach of letting pain be my guide, so to speak, but some of you may have done this as well, and this may not be a good strategy because it may really limit you, and you may not feel like you want to do too much because you may be always in pain, so you may not do much in the first place. Then there's the other extreme, right? No pain, no gain. You hear this a lot. I am not a fan of this concept or approach, even when it comes to exercise and strengthening. Pain is there to tell us something. So the issue and the more likely thing that has happened with things like chronic pain is that our awareness of sensation of pain has likely just become more overly sensitive, or our brain has been trained to think this way and overreact. Kind of like when you're like super ticklish and you may get tickled by even a feather or something, or even the anticipation of getting tickled would make you ticklish, right? Even before like the stimulus actually touches your body. So those who follow this no pain, no gain concept will likely at a certain point overdo things and experience like a flare up in pain. And they may have so much pain because they're doing so much and ignoring it that they may be forced to really rest because the pain is maybe so unbearable. And then so they may go down into this immobile state or this state of like less activity. So then they're going up and down, but it's a repeated cycle. So this doesn't really seem to be the way. And I've kind of overdone it like this as well because I've tried to push through it. But in the end, it kind of just is no better than the other approach of letting pain be my guide. So the third and better approach, like anything in life, is probably finding a healthy middle ground between these two approaches. Respecting pain to a certain degree, but also understanding that discomfort like soreness can be overcome. And it's okay for when we do what we can without having this pain or eliciting it, at least. So I think that the first step in your journey to managing or even treating pain, like I'm pretty hopeful, is really set some goals, whatever it may be. And I think a good goal overall, from what the research I have found, is to really understand pain itself, like from an educational concept kind of thing. Like we all know what pain is, but a formal scientifically based, like modern pain education, down to like learning about what causes it and how our things like our central nervous system, our spinal cord, even like what parts of the body and like how nerves work, like that degree of learning in a way that may be interesting so that you understand what's going on in your body. So that I think that probably helps with some of the fear or some of the anxiety that is associated with pain. So the first aha that I had that I'm sharing with you is that when you seek treatment for your pain, there should be no one size fits all approach because your pain is very real and it's unique and it's not just in your head. Just like how there's no one car, right, that's right for everybody. Some may want like a sedan, some may want an SUV and a truck and so on. What works for someone may not work for you. And the same applies for pain management and treatment because there are so many factors. Even someone the same age as you, the same like condition, same gender, very same thing, two very different people. It may work for this other person, but it may not necessarily work for you because there's so many other factors, right, that are at play here. So taking this further, I think that if you're like seeking a diagnosis or therapy or like finding a lot of doctors or doing a lot of testing, it may not necessarily be the key to your pain because I think this approach puts it all on the other providers or the other treatments. First, I think a good goal is understand what's going on in the first place. And that understanding can be very powerful and empowering, right? Kind of like if you understand how things work in the first place, then you can do it a lot better. Like I've gotten into plants and gardening, right? I can kind of like do it like experimentally, trial and error. But if I really like studied the plants and like how the biology of it works, like the components of like water and light and like how even the specific plant and what it needs, like I can probably have that plant be more successful and grow much better than likely trial and error, right? Or just like doing what people are like recommending and like not really going into the education and the research. So like anything, I think getting right to the source of the best practice is probably the key to being most successful. And not everybody knows this, surprisingly. Some healthcare practitioners and doctors may not even be on top of pain because pain is kind of like a specialized area, like believe it or not. So like, how do we learn about pain? There's like so much to it. Like this could probably be in like a college course in itself, right? It can be a lot of information, definitely more than one that could be talked about in like a single video that I can make. So I plan to make a video series all about pain education standpoint. So in the meantime, I highly encourage you all to speak with a medical provider and ask them to provide you with resources or recommendations for how to learn about pain itself in a way that is meaningful and interesting to you. And if they don't know, that's okay. Just see if they can refer you to somebody else or find another provider. And so as a medical professional myself, who this day experiences pain occasionally, I am excited to be sharing this all with you in the spirit of profession of occupational therapy to help people to live healthier and happier lives through their meaningful activities. I will also share in this video description a resource in the meantime to get you started, and that's from the CDC titled Safety and Effectively Managing Pain Without Opioids to get you started. Good luck on your pain journey, and I will see you all in the next video. Thanks for watching.